Welcome back to our podcast on sexual and reproductive health and rights SRHR for people with disabilities in Pakistan. In this episode, we will be discussing the critical issue of stigma and discrimination faced by people with disabilities when accessing reproductive health and well-being services. Our guest today is Hira, a passionate advocate for disability rights who is dedicated to ensuring that healthcare is inclusive for all. Welcome to the show.
Thank you for having me. I'm really glad to be here. As someone with a disability, I have seen how stigma and discrimination create barriers to accessing reproductive health services and information. This is a widespread problem that needs attention and action at all levels.
That's such an important point. Can you share how stigma and discrimination show up in health and well being for people with disabilities?
Of course, one of the main issues in the assumption that people with disabilities don't need reproductive health services and information and are just neglected in all aspects. Because of this, healthcare providers might avoid offering these services and feel uncomfortable discussing them with us. Sometimes they even make insensitive or hurtful remarks.
That sounds so difficult. What do you think needs to change to create stigma free and inclusive SRHR services?
First, healthcare providers need proper training to understand that people with disabilities have the same SRHR needs as everyone else. They need to be taught to challenge their biases and treat us with respect. Second, we need facilities that are accessible. This means having ramps, sign language interpreters, easy to read materials, and equipment that works for people with different disabilities. These changes make a big difference. Lastly, people with disabilities must be involved in planning these services. When we are part of this process, the solutions are more effective and truly inclusive. Nothing about us without us should always guide these efforts.
That's a powerful message. What can be done to address this issue and ensure that people with disabilities have equal access to SRHR services and information?
Public awareness campaigns are vital. These campaigns should challenge negative stereotypes about disability and SRHR. They need to include positive stories and be accessible to everyone, whether it's through braille, audio, or sign language.
What role do policymakers and decision makers have in solving this?
Policymakers have a big responsibility. They need to ensure laws clearly ban discrimination in healthcare and create ways for people to report and address violations. It's also important to provide funding for programs that make SRHR services inclusive and accessible.
Those are excellent points. Are there any successful examples of initiatives that address these issues?
Yes, indeed. One such initiative in the work done by YPR Pakistan and ISYD, they have pioneered a project that trained deaf communities on SRHR and life skill based education. While the project is on a smaller scale, it has been successful in empowering individuals to become peer educators. These programs are not only helping to spread crucial information but are also challenging stigma and promoting the inclusion of people with disabilities in SRHR services. However, there is still work to be done to expand these efforts and raise awareness on a larger scale.
That's so inspiring. It really shows how involving the disability community leads to better outcomes. Thank you for sharing your insights and experiences with us today. I'm sure our listeners have learned a lot.
Thank you for having me. I'm hopeful that through awareness, collaboration, and advocacy, we can create a more inclusive SRHR system for everyone.
Absolutely. Join us next time as we explore the cultural barriers faced by young girls with disabilities and strategies to overcome them. Until then, thank you for listening and please share your thoughts with us.